Thank you guys for joining me tonight, this on a Friday. It's great that you opted to give me, 45 minutes or so of your time. Hopefully it'll answer some of your questions and then help you get to know a little bit more about pelvic floor physical therapy. Um, During the webinar, it's really meant for you guys to learn a little bit more about pelvic floor physical therapy and pelvic health, PT in general, what the pelvic floor is, some of the basic questions that a lot of people have when they come to see a pelvic health PT, or maybe when they're deciding whether or not they want to come see a pelvic health PT. So there'll be some main questions that I try to answer for you guys, but please, if you have anything specific you want to know, put it in the chat. I'll try to keep an eye on that throughout the webinar, and I'll answer as much as I can. Also, too, we're hoping potentially, if this is something that you guys seem to like and you're interested in, maybe we'll have some more webinars in the future. But we want to hear maybe more about what you guys are interested in learning about. So if there's a special topic, obviously for me, specifically for pelvic health PT, that you're interested in learning about, maybe it's pregnancy and postpartum specific, or incontinence specific, pelvic pain, anything specifically that you're like, yeah, I'd like to know some more details about that topic alone, send it in the chat. We'll gather them up and maybe you'll see a webinar in the future specific to that topic. But yeah, for now, let's get started. So for today's webinar, you'll learn these 4 things. So we'll go through a section on what the pelvic floor is, what pelvic health PT is in general, and what you should expect from your first appointment with me or another pelvic health PT. Who specifically could benefit from pelvic health physical therapy? So maybe what symptoms could prompt you to come see a pelvic health PT, or maybe a diagnosis that you received, or maybe you're just looking to optimize your pelvic health in general. Maybe you're not experiencing something specific, but you just want to make sure everything stays good. And then at the end, we'll do more of a question and answer, but I might also answer some questions as we go if they're popping up in the chat and it makes sense as we go on tonight. Okay, so first and foremost, what is the pelvic floor? So you can see here, I have pictures on the right-hand side of my screen. Those are various pictures of what the pelvic floor is. That first top photo is an aerial view from the top. So you can see more the bony structures of your hips going down into the pelvis. So let's see if I can show you a picture of my model in real time here. So this is a pelvis. This is a female pelvis. You can see these bony marks here. Hopefully you can see that okay, are your bones of your hips. And then in the back here is your spine. So that top picture is looking at the pelvic floor from this direction. So almost inside that, we call it your pelvic outlet or your pelvic cavity. Those red muscles you see, that is part of your pelvic floor. So that's one view. And then those 2 bottom photos there, the middle one is actually a male pelvis, and the bottom picture is your female pelvis. So both men and women have pelvic floors. So both men and women can benefit from pelvic health PT. These muscles, they're a group of muscles, multiple layers. So each layer does a little bit of a different type of function, but they all work together. And they sit, as you can see, in your pelvis like a hammock or a sling to help with some of these functions we're about to talk about. So one of the ways that the muscles work together are to support your organs. So your bladder, your bowel, if you're female, your uterus, all sit in that pelvic bowl, and your pelvic floor helps to support those organs. They're also part of what we call your deep pelvic or your deep core. So it helps you with breathing. Your diaphragm is part of that. It helps you to sit and stand and be in an upright posture and move around. So when you think about moving around, bringing your arms up and down, you think, oh, that's just my upper body, right? It's just my arms. but your pelvic floor is giving you stability through your core so that you can do that without falling over. So it has a really specific role and function for that as well. It also has what we call sphincteric function. So it helps to control your bowel and your bladder. Sexual function, it's involved in the ability to orgasm or have arousal. It's also involved in circulation. So helping your blood and actually your lymph system kind of pump up towards your heart, which is kind of cool. And then, of course, if you were to have a baby, it helps with vaginal delivery. So that is what your pelvic floor is and where it's located. How does that translate to physical therapy? What is pelvic health physical therapy specifically? So as physical therapists in general, right, I have a degree in physical therapy in general. I have just specialized in pelvic health, the pelvic health portion of that. So as physical therapists in general, we focus on how is your body moving and how is it functioning. These things are specific to your muscles, your joints, your ligaments. We call it your musculoskeletal system. So those aspects of your body. We look at how any physical impairment you might have to that system impacts how you're moving and how you're functioning. So not just your physical health, like can you run, can you jump, can you stand and walk around, but if you're having an impairment in your function, how is that impacting the rest of your well-being? So is the fact that maybe from a pelvic health perspective, you are having issues with controlling your bladder, how is that issue controlling your bladder impacting maybe your social or emotional or mental health? We are focusing on that physical portion, but it impacts the rest of your well-being as well from those aspects. Pelvic health PTs, we take a more specific deep dive or deeper look into the pelvis in general. So part of that is your pelvic floor that we just talked about, but then also those other muscles that surround your pelvic floor. So your abdominals, your low back, your hips, your diaphragm, posture. We're looking at the whole of your person, but we are just trained more specifically to know what's going on in that pelvic region too. Those things that can be impacted by pelvic health could be some of the things we talked about in that previous slide. So bowel function, bladder function, sexual function, pregnancy and birth, things of that nature. As a physical therapist in pelvic health PT, we're looking at strengthening what might be weak or relaxing muscles that might be too tight, improving coordination of those muscles and how they're moving in general. Can they get through their full range of motion? And can we help to decrease pain? So just like any other muscle in your body, your pelvic floor, if it's too weak, you're not having the strength that you need, we need to work on that. If your pelvic floor is too tight and it can't relax, we have to work on that so that we can get that full motion. For example, if you were to think about your bicep, if you had a bicep that was really tight and it stayed like this, you wouldn't have optimal function of your arm because it also has to be able to relax. Same thing if your bicep and your arm is too weak, you're not going to have optimal function of your arm because you won't be able to lift things like you need to. So the same principle applies to your pelvic floor since it's also a muscle, just in a little bit of a different way that we go about examining and treating it. Okay. And then ultimately our goal as PTs or pelvic health PTs is to empower you to learn what you can do to help yourself. So physical therapy is one of those things. It's not necessarily a quick fix. Sometimes things can be 1 or 2 visits and we tweak something a little bit, maybe a habit that you're doing or a way that you're sleeping at night, and it seems to help whatever your ailment is. But that's usually not the case. Usually it takes a lot of patience and discipline, takes time and hard work, and a lot of consistency on your end. So our goal as a PT is to help give you those tools, give you the exercises, the knowledge, but ultimately it's a team effort. We can only provide you with that. You have to do a lot on your end to help yourself feel better too by doing the homework that we give. So ultimately, empowering you to know what you have to do to help yourself feel better. In a nutshell, pelvic floor physical therapy is a non-surgical conservative approach to helping restore function in your muscles and tissues that contribute to things like bladder concerns, bowel concerns, your sexual health, various pain complaints, pregnancy and postpartum wellness. The PT that you go to, so this would apply to me if you came to see me, will use different approaches and strategies to help you achieve the best function that you can based on whatever it is you're coming to see them for. So some of the things a physical therapist who specializes in pelvic health might suggest would be different exercise recommendations, maybe some stress relief strategies. So this is a huge topic, but hopefully you haven't experienced too much the effects of stress on your body, but stress has a huge impact on our overall well-being. And that also applies to your pelvic floor. Just as a quick example, a lot of people suffer from tension headaches. So tight muscles up in your upper body can create feelings of tension headaches in your head because of the tight muscles down here. Your pelvic floor is also an area of your body where those muscles kind of carry a lot of tension if you're stressed. Not for everybody, but some people are more prone to it. So stress relief strategies can help relax your pelvic floor and hopefully improve your symptoms if that's part of what's going on for you. Maybe we focus on behavioral changes or modifications. So for example, maybe you have learned, go to the bathroom before you leave the house just in case. For most people, doing that every once in a while is not a big deal, but over time, sometimes that can train your bladder to always feel like it needs to go. You're going really frequently. So maybe one of my recommendations might be to change up when you go to the bathroom to lower any consequences of that, as an example. Other things we might focus on would be manual soft tissue work or a type of massage to help the muscles have ultimate movement. And then retraining of movement patterns, optimizing how your muscles are activating. Can they kick on and contract when they need to? And then sometimes you use different devices and equipment that might help you accomplish whatever your goal is. So I'm going to show you some examples of some things potentially you might see if you go to a pelvic health PT, just so you're familiar with them and it's not a surprise. So one of the tools or devices that we might recommend is something called a pelvic wand. It looks like this, like an S shape. This is a device or a tool, typically is used, men or women could use it, but a lot of times women will use it if they're experiencing, for example, maybe pelvic pain associated with a tight pelvic floor. So this tool is typically used to relax your pelvic floor as a treatment that you can learn how to do at home. It's very useful for individuals who maybe need multiple soft tissue or massage work sessions and they're not coming into the clinic that often. I can help you learn how to use this so you can do some of that work on your own as part of your homework. So that's one tool. It would be used internally if I didn't say that already. Another tool you might see is called a dilator. So these are sets of dilators. This is just one brand. Most of these tools have a bunch of different brands you can choose from with just different pros and cons depending on what you need. But dilators, they do exactly what they're called. They help to dilate or increase the size that is comfortable to have something inserted vaginally. So for example, a time that you might use that, say you're an individual coming in and you say, I'm really having a hard time with intercourse, it's really painful, or having an internal exam is really painful. I might suggest, if you're comfortable, using something like a dilator, and you would work up a size slowly until whatever it is that needs to be inserted is now comfortable because you've practiced with something similar size. So that's another tool that you might be recommended if depending on your comfort level. Okay. So, what to expect for your first visit with a pelvic health PT? When you first come in, usually I'll see you for at least an hour, depending on what you need. And a lot of that visit is us talking. We talk a lot. We chat about what it is you're going through. What are you experiencing that led you to come in? What symptoms do you have? Maybe who recommended you come if that was the reason you were coming. And then aside from you sharing your story, I'm going to ask a lot more specific questions that will help guide my examination and potentially my treatment that will help you the most. So depending on what you tell me, I might ask you some follow-up questions regarding your bladder, your bowel, what your exercise tendencies are, any pain complaints you have, like maybe you're having pelvic pain, but I ask if you also have back pain or any hip pain, any sexual concerns that you might have, whether it's about pain or arousal, things feeling differently after having a baby, maybe asking about your pregnancy and birth history, or if you are pregnant, how that course is going so far, if there's any complications. And then once we chat a lot, again, that's a big chunk of that first visit is us just getting to know each other, me really figuring out the nitty gritty of what brings you in, what is your history, what's going on. Then I'll make sure you feel informed about what your pelvic floor is. So hopefully you learned a little bit more today, but if you were to come in, we talk more in depth about what the pelvic floor is based on what your complaint is, maybe what I think might be going on. I'll show you on the model what to expect from the pelvic floor assessment if that is indicated for you, and make sure you feel comfortable with the plan of the visit before we move on. If once we talk, it's kind of concluded, yes, I think a pelvic floor assessment might be to your advantage or the best course moving forward, what does that entail? So a pelvic health muscle assessment is typically both an internal and an external exam, depending on what it is you specifically have going on. The external portion, it's helpful really for us to assess all of your external muscles, your posture, how are you breathing? What is the strength through your body, through your legs, through your hips, through your abdomen? What is your flexibility like? Are there any tight muscles that are preventing you from doing certain movements that you need to be able to do? Movement patterns that could impact your pelvic health. So maybe how are you getting up out of a chair? How are you walking around? How are you sitting in a chair? How do you get in and out of bed? Again, I don't necessarily look at this for everybody, but if it's indicated based off of how we talk about what's going on, that might be something I look at. And then the internal portion is performed to assess the muscles specifically of your pelvic floor. So that would go back to this model. These red muscles here, more the outside of that perineal area or that vaginal area if you're a female, and then the inside, the deeper muscles as well. When we do a pelvic floor assessment, it's done to determine how are the pelvic floor muscles specifically functioning. So can they contract when they need to? Can they relax when they're supposed to? Are they painful when they're touched? Are they too tight? Is there any scar tissue that's going on in that area? It's important because these muscles, they, like we talked about previously, help your body function in a lot of important ways. So if they're not functioning the way that they need to, if they're not contracting, if they're not relaxing, if they can't go through their full range of motion, etc., it could potentially be part of the reason you're experiencing whatever symptom it is that you came in to see me for. So maybe you're having bladder linkage or you're having pain, etc. So figuring out how they're functioning helps me then determine, is this potentially contributing to what you're feeling? And then how do we go into helping you feel better? What does the treatment look like? An internal muscle assessment is typically a single digit exam, and it's performed vaginally or rectally, depending on your concern. If you're a male, it's performed rectally. If you're a female, typically I'll perform it vaginally, but if you're having only specific bowel symptoms, I may recommend a rectal exam, depending on the person. An internal muscle assessment, just like any portion of your exam, is always optional. It might be highly recommended, but we only do what you're comfortable with each session. So it can change session to session, and we'll talk about it in advance. So just know you always have the final say. And then after we do the physical assessment, whether it's an external assessment, an internal assessment, or both, we'll sit down again and we'll kind of discuss what was found and develop a strategy that feels good to you for your rehab. So something that you feel might work well into your current life, including how often you might have to do it, how many exercises or habit changes, suggestions I have, what works in your current season. We'll talk about that, and we'll go from there. Okay, now diving into who specifically might be able to benefit from pelvic health PT. Those with bladder concerns. So maybe you're experiencing bladder leakage. Maybe you feel like you always have to go. You're having that frequency. Maybe it's really urgent. So you feel like, oh, I have to get there right now. I can't hold it. Maybe actually urinating or going to the bathroom is painful for you. Maybe you feel like, all of a sudden I'm going and it's stopping and starting. It's not this fluid stream like I used to have, or I think I should have. And maybe you're having a hard time emptying your bladder fully. Those would all be reasons why you would come see me, a pelvic health PT. Those who are having bowel concerns could also benefit. So maybe you're having bowel incontinence, maybe you're having constipation, or you feel like you really have to push to empty your bowel all the way. You're straining a lot. It could also be painful for you to go, or maybe you feel like you can't, no matter how much you strain, you can't empty all the way. Pain concerns in general would also be another area where people would come see a pelvic health PT. So any type of pelvic pain, whether it's, I'll bring my model out here again, pubic pain. So that would be kind of in this front region below your navel. Sacral pain, which would be kind of in the low back, right above your tailbone. So tailbone's down here. Sacrum is right above it, so very low back. Maybe you're having abdominal pain or pain in the genital area. So your vagina, your penis, the testicles, maybe the tissue in between, your perineal area. Any of that might potentially be a pelvic floor concern that could benefit. Maybe you're having rectal pain specifically, spasms in that area. Maybe intercourse or any type of sexual activity is uncomfortable for you, or even a pelvic exam. So maybe intercourse feels okay, but pelvic exams, say at your OBGYN or your midwife, that's uncomfortable for you. Or pain related to your menstrual cycle. So for example, I see quite a few women who have endometriosis, and pain because of that endometriosis. Pelvic floor or pelvic health PT potentially could help you with that too. And then some miscellaneous concerns would be pelvic organ prolapse or symptoms of a prolapse, postpartum wellness or postpartum concerns, pregnancy wellness or pregnancy concerns. So maybe in general you feel okay, but now you're pregnant and you're feeling some aches and pains you didn't used to. Maybe you're having something that's called a sciatica flare up in your low back and your leg. Anything that kind of crops up pregnancy wise, potentially from a musculoskeletal perspective, could benefit from pelvic health PT. Maybe you're a male and you're having erectile dysfunction concerns, or male or female, maybe you're having a lack of sensation in that perineal area. And this is a general list of some things that can help. So if you're having something related to your pelvic health that's not on this list and you think, oh, I'm wondering if maybe pelvic health PT could help me, reach out. It could definitely be something that could help, and it might just not be on the list. Okay, so now we're going to go through a few examples of different treatment approaches that you might expect for a few examples of symptoms or concerns. So these are just examples. Every person is unique, including what they're feeling and what their rehab journey will look like. So even if this example is the symptom that you're experiencing, the treatment that I'm going to give as an example is just an example. So every person might have a different rehab journey per se. So take that as a caveat. So the first example would be if you're experiencing bladder leakage, these 4 things might be areas that we might touch on to help with your bladder leakage. So I probably will teach you how to contract, relax, and lengthen your pelvic floor properly. So just like going back to this bicep example, just like in your bicep, it needs to be able to contract and relax and lengthen in order for you to have full function of your arm. The same applies to your pelvic floor. So I probably would start there, making sure that you have the ability to do that. And then if you're having bladder leakage, I might have you do various exercises to help strengthen your pelvic floor. So that might look like pelvic floor contractions, or sometimes people refer to them as Kegels. It might look like some lower body exercises. Maybe I might have you do squats or lunges, bridge, or abdominal or core work. So some of the exercises look like regular exercises you would be doing in your everyday exercise routine anyway, but lo and behold, they actually impact your pelvic floor. I might have you optimize your bladder habits. So we might talk about how much water are you drinking? What would be a good goal for you? Do you need to drink more? Do you need to drink less? And then how often you're using the bathroom. So maybe your habits surrounding how you empty and fill your bladder are potentially contributing to that bladder leakage. And then I may do some massage work to optimize the muscles and tissues of your pelvic floor or your pelvic girdle in general. So it could be internal or external, depending on your needs. So again, this is an example of someone who's experiencing bladder leakage. However, the solutions that I gave on the right-hand side there, that's an example potentially of something that I might suggest. But just because you're having bladder leakage doesn't mean this is the blueprint. This might look different for you depending on the person. The same would hold true for the second example. So example 2, if you're experiencing pelvic pain or pain with intercourse, we might focus on, again, making sure you know how to contract, relax, and lengthen your pelvic floor. We may work on relaxing any tight muscles or muscles that are tender and painful through different exercises and techniques. So we might do some breathing exercises, we might do some stretching, we might do some massage work, and we might try to optimize the muscle balance through your pelvis. So what does that mean? It might sound kind of counterintuitive, but sometimes pelvic pain is there as a byproduct of some of those pelvic muscles being really tight, or a surrounding muscle being really tight. So maybe a muscle in your hip. Sometimes doing stretching and massage work can help those muscles to relax and your pain feels better. Sometimes stretching and massage or soft tissue work isn't quite enough, and we have to do some strengthening of other muscles in order to let the muscles of concern relax better. So it can be a little bit more complicated than just stretch something that's tight. I might do some education with you to learn about appropriate lubricants for intercourse if that's something that's painful for you. or we might use dilators or wands. So those tools that I showed you earlier. And we might also talk about stress reduction techniques. So we talked or alluded to this a little bit before, but stress can often contribute to pelvic pain for some individuals. So that potentially could also be something that we discuss in your visits here with me. Okay, so as I said before, if what I talked about today, maybe it sounds like you and you say, yes, I could really benefit from pelvic health PT, or maybe you have something else going on and you're still not quite sure that pelvic health PT is an option for you or would be advantageous for you to check out. If you have any questions on whether or not it would be something that you could benefit from, give us a call, ask to talk to me. That's absolutely fine. I would love to have a conversation with you and either give you my opinion of, yes, I think it can benefit, or no, that's not my area. I would suggest maybe you go see this professional. I would love to have that conversation. So definitely give us a call. And then if you are looking to make an appointment, here's some information that might be helpful for you. So in Ohio, because I am a doctor of physical therapy, I have direct access privileges. So that means for most cases, you can come to see me without a referral from your doctor. In some cases, especially with insurance requirements, sometimes a referral is necessary. So just reach out. We'll let you know potentially what might be the case for you. Veranova Health does take many different insurances. Again, if you have any questions regarding yours, reach out and we can give you more information of, yes, we're covered, or no, we're not, but we do have a cash option for those insurances that aren't covered. So that's a good option too. Our phone number there, you can call to make an appointment or you can visit our website. That's also an option. You can make an appointment right online. Okay. If you have any questions, feel free to put them in the chat. Otherwise, I'm going to give, as you're kind of putting some questions in, I'm going to give a little bit of a tour around my room so you can see a little bit more of the setup here. Let's see. Okay. So I'm not sharing the PowerPoint anymore, so you guys should just see my room, hopefully. So this is, it's not the best, but that's my treatment table there. And that would be where we would do exams if you came to see me. We would do exercises there if you needed a surface. If you're standing, obviously we would be standing. And then exercise ball, there's a mirror and some weights. In another cabinet, we also have a yoga mat or a Pilates mat, depending on what you're used to calling it. We have some more exercise balls. I have some resistance bands. We have different tennis balls we use for different things. So just like you would see in a physical therapy clinic that you go to for your back or your hip or your knee, we do a lot of exercise here. It's just in this specific. All right. Any questions you guys have after going through that presentation that might help ease your mind or answer anything you're curious about?
Tell you, Megan, I've worked with you this past year and I've never learned so much about pelvic floor physical therapy. So thank you.
Good, I'm glad.
I have a question. So I have been a previous recipient of pelvic floor physical therapy about 8 years ago, probably. And I came to that only after like a year-long process of going to traditional doctors, including like a urologist, who's like, you have prostatitis, you have this, you have, they just kind of went through a whole list of things until going to a different doctor who's like, the other doctor, he didn't say he was an idiot, but he's like, you need, your issue is not as complex as they're being told. I'm curious how often that happens with people who are coming to you, where they're coming to you only after kind of exhausting, I'm gonna say, like traditional causes for their symptoms, like a UTI, or in the case of a man, like prostatitis or other perceived issues.
Thanks for sharing. Yeah, I have seen that quite often. Not to say pelvic health PT is the end all be all and it can fix everyone, but I think just like the reason we're having this webinar, pelvic health PT is still something that isn't really widely known or understood. So there are a lot of concerns and ailments that are muscle related or nerve related, that musculoskeletal branch of health, that physical therapy could be a prime treatment option that's very conservative and has great results when used the right way. But a lot of providers don't understand it, or they haven't experienced it for their patients yet. Maybe they're not educated on who could benefit, and that's why they don't use it. But you're not alone. I've seen quite a few people in my time as a provider that have come to PT and have had great benefit, but it was after potentially years of other treatments that did not work. So thanks for sharing. Let's see, I did have a question in the chat. Good question. So we have a question about strengthening the pelvic floor and if Kegels are effective compared to other exercises, if I'm understanding correctly. So I would highly recommend, if you think that your pelvic floor needs strengthened, please, please, please be evaluated, because sometimes the symptoms that are mimicking what we would call a weak pelvic floor or a pelvic floor that needs strengthened potentially might not be a weakness at all. It could be tightness or something else going on. And so strengthening your pelvic floor, especially doing Kegels, potentially could make your symptoms worse if you think it's a weakness, but it's actually something else. So first caveat would be, please, please, please go get professionally evaluated by a pelvic health PT to confirm what it is you think is going on. And then if it's, yes, it definitely needs strengthened, where do I go from here? Obviously, if you came to see me or another pelvic health provider, we would guide you on our recommendations of what to do. The question of Kegels versus other exercises. Kegels, in my knowledge and skill, are helpful for individuals to gain awareness of that area. The pelvic floor in and of itself functions, we call it, in a synergy with some other muscles in your body. So your core being one of them. And so some people just don't know where it's at. So Kegels are a really great way, in my opinion, of bringing awareness to that area. But if you're having pelvic floor weakness, a lot of other exercises that don't have anything to do with honing in on the pelvic floor specifically or Kegling specifically can strengthen your pelvic floor just as much. So one of them being squats, or if you've heard of bridges, where you're laying on your back and lifting your hips up. So different lower body exercises will strengthen your pelvic floor just by doing that exercise, because your pelvic floor kicks on to support you while you're doing that exercise. So Kegels can be used, but other exercises can be used too. So marrying the two appropriately is key in my opinion. Hopefully that answered your question, Jennifer. Anything else you're curious, or experiences you had, things you want to share or gain insight on? Anything you guys would be interested in having a specific webinar on? So pregnancy specific webinar or prostatitis, anything like that, you can add that in the chat. I'll mark it down for future webinars. Again, if there's something you kind of have on your mind, but you're not in the realm to throw it out publicly on a Zoom, give us a call. We can talk privately. That's great too. I would love to do that for you. Thanks. I'll stick around for a few more minutes, but that's all I have for you guys, unless if there's any more questions coming in. So thank you all for joining me tonight and learning a little bit more about something that I have great passion for. As an aside, I don't know if you guys know this or not, but one of the reasons I got into pelvic health is because I also needed a pelvic health PT. I've gone through my own rehab journey. So I have an affinity for also what you're going through, and I love it. I think it's important. So hopefully that helps ease your mind too. But yes, thanks so much for joining. I hope you have a good night, a good weekend. Call if you have questions, and I'll stick around for a few minutes to answer any.